Hi, I'm Chris Kotlowski, and I am thrilled to be with Dr. Libby Paskey, and she is co-owner of Infinite Athlete Chiropractic and Rehab. So I have been a patient of Dr. Libby's for a while now, but over the course of a lifetime, different seasons, you have to seek professional help. So I think you're unique, but I would like you to share with others as to what sets you apart.
Sure. So thank you for having me on today.
Thank you.
I think something that sets us apart is that we take a more full body, holistic approach to things. Typically, people think of chiropractic as just adjusting, crack them, let them walk out the door. And I think you can agree that that's just not the experience that we have here.
That's right.
I very much believe in everything is connected within the body. So not just to treat joints, but also the muscles and the tissues that attach. So it's all a part of the complex. It's all a part of the problem generally. So I'm not just looking at one area. I'm not just looking at the area of pain. I'm looking at how everything works and functions together. So it's not just chiropractic here. We also do a lot of soft tissue work. I think you would agree, right?
Yes, yes.
And also looking to help prevent any aches and pains or dysfunctions that come into the office, and that includes rehab and corrective exercises. So we do a little bit of it all.
Okay, so let's go back to you work with soft tissue. If I hadn't had your wonderful expertise and your abilities, what does that mean?
Sure. So most people, that's working on muscles. We also have other tissues in our body that aid in movement. So it's working on those. When we are adjusting areas, we have muscles that connect in and around all of those areas that get tight, they get sore. So working on those also helps in, totally blanking.
That's okay. We're going to just pause that. We're going to
Pause it. What am I trying to say?
We'll just continue on it, and then I'll edit that. And I can't edit in between, but I can stop and then put it together. So let's go back to, I think, your soft tissue.
Okay.
So when you say soft tissue, the average person might not know what that even implies.
Right.
What does it mean?
Sure, it's more of a technical term, right? So it's body work, muscle work, what you might commonly feel in, say, massage or something like that. So because things are so complex within our body, it's never just one thing. So I look at the whole entire area. Our muscles get tight, our muscles get sore. And if we don't treat those, then it's really hard to treat deeper structures, that being spine and joints, and that's typically what's treated within chiropractic care.
Right.
So I find that doing soft tissue work and working those elements as well really gets us better and quicker results, and also just helps people feel better faster.
Right.
Yeah.
Well, I would say that Dr. Libby is unique because when a person comes in for an appointment, it isn't just, I have a pain here or I have a pain here.
Right.
You take the time to kind of see where everyone is at. I'm assuming everyone is kind of similar to me, but I don't know. And then you proceed. And it's amazing to me that a pain that is somewhere may be stemming from another part of our bodies, right?
Right. Yes.
Can you talk about that a little bit?
Well, it's really easy to chase pain. That's what we call it in our profession.
Okay.
Is getting so hung up on where the pain is.
Right,
Instead
my
of
hip.
Right. Instead of looking more globally, and this is much more functional when evaluating of understanding how things all work together. So if you have pain at your wrist, or commonly, a common thing that comes in here is tennis elbow.
Yes, yes.
It's not normally just an issue there. It's stemming from how the shoulder moves, how our shoulder blade moves, how we're moving through our neck and this entire girdle. And then it just kind of leaks downward, and then all of a sudden it just shows up there.
Right.
So,
So someone could come in with a pain anywhere in their body and immediately have results and say, I feel 20 years younger. Or it may take a few times of visits.
Yeah.
So let's talk about your philosophy or the way you care for your patients after,
Sure.
from the first appointment and forward.
sure. Well, everyone's a little bit different. One thing that I do like to say, and I'm going to use a little bit of a car analogy, is that if we have an indicator light that goes off in our car, normally it's not just something that happened right in that instance that's an issue. It's been a slow breakdown of things. It's the same thing for our body. Pain is normally the indicator light that everybody responds to because it's uncomfortable, right? The brain is telling you we need to do something about this. But it's normally not the first thing to happen. It's always not the I guess, sorry, I'm jumbling my words a little bit.
Okay.
It's not the first thing to happen, and it's
There's
the
leading
first
up.
thing to go away. So,
Interesting. It's
not
can you
just-
say that again? It's not the first thing to happen.
right, we normally have other breakdowns that we can deal with, we can compensate with, but then our body just can't handle it anymore. That's when we elicit pain.
Sure.
The brain needs us to pay attention to this. That is then the first thing that goes away, but it doesn't mean that all of those things that led up to it have resolved.
Have been resolved,
Right.
right? So someone says, I cannot deal with this lower back pain or my
Yeah.
shoulder pain. They come in. I think if you've never had chiropractic care, it might be a little scary. You don't know what to expect.
Sure, yeah.
But I have to say, like, your approach is wonderful, and you do educate your patients along
to,
the way.
yeah.
And I'd also like to say, like, when a patient leaves, you might give them stretches or things
yeah.
that they can do at home
Right.
to, extend the longevity of your treatment until you may or may not see them again, correct?
Correct, yes.
And specific stretches or you may, is there like topical ointments or what can a person do
Self-help.
self-help.
Yeah.
What do you suggest sometimes?
Oh gosh, a whole bunch
lot.
of things.
Where is the list?
Yeah. Well, and one thing that I try to achieve here as well, I don't know about you, but it's hard to go to all different places to handle the same thing, right?
Right.
So chiropractic is one stop, then massage is one stop, then PT and rehab is one stop, and our lives are super busy.
Right.
Even during COVID,
Exactly.
our lives are super busy. So I try and make it where we can take